Leukocytosis is a white blood cell count above the normal range in the blood. It is frequently a sign of an inflammatory response, most commonly the result of infection, but may also occur following certain parasitic infections or bone tumors. It may also occur after strenuous exercise, convulsions such as epilepsy, emotional stress, pregnancy and labor, anesthesia, and epinephrine administration. There are 5 principal types of leukocytosis: neutrophilia, lymphocytosis, monocytosis, eosinophilia, basophilia. This increase in leukocytes is usually accompanied by a left shift in the ratio of immature to mature neutrophils. The proportion of immature leukocytes increases due to proliferation and release of granulocyte and monocyte precursors in the bone marrow, which is stimulated by several products of inflammation including C3a and GCSF. Although it may indicate illness, leukocytosis is considered a laboratory finding instead of a separate disease. This classification is similar to that of fever, which is also a test result instead of a disease. Right shift in the ratio of immature to mature neutrophils is considered with reduced count or lack of young neutrophils in blood smear, associated with the presence of giant neutrophils. This fact shows suppression of bone marrow activity, as a hematological sign specific for pernicious anemia and radiation sickness. A leukocyte count above 25 to 30 x 109 per liter is termed a Leukemoid reaction, which is the reaction of a healthy bone marrow to extreme stress, trauma, or infection. It is different from leukemia and from leukoerythroblastosis, in which either immature white blood cells or mature, yet non-functional, white blood cells are present in peripheral blood. Leukocyte counts, below are blood reference ranges for various types leukocytes WBCs. The 97.5 percentile is a common limit for defining leukocytosis. Classification: leukocytosis can be subcategorized by the type of white blood cell that is increased in number. Leukocytosis in which neutrophils are elevated is neutrophilia. Leukocytosis in which lymphocyte count is elevated is lymphocytosis. Leukocytosis in which monocyte count is elevated is monocytosis. And leukocytosis in which eosinophil count is elevated is eosinophilia. Causes: leukocytosis is very common in acutely ill patients. It occurs in response to a wide variety of conditions, including viral, bacterial, fungal, or parasitic infection, cancer, hemorrhage, and exposure to certain medications or chemicals including steroids. For lung diseases such as pneumonia and tuberculosis, WBC count is very important for the diagnosis of the disease, as leukocytosis is usually present. The mechanism that causes leukocytosis can be of several forms: an increased release of leukocytes from bone marrow storage pools, decreased margination of leukocytes onto vessel walls, decreased extravasation of leukocytes from the vessels into tissues, or an increase in number of precursor cells in the marrow. Certain medications, including corticosteroids, lithium and beta agonists, may cause leukocytosis. See also, bacterial infection, complete blood count, leukocytosis in head trauma, white blood cell. References